Jonathan nicely introduced me. My name is Dr. Kimberly Alba. I am a clinical assistant professor and licensed clinical psychologist at Stony Brook Medicine, specifically at the Department of Psychiatry and Behavioral Health in the Child Division. So I primarily work with children and adolescents. And I also do a good amount of work with adults and parents. So I'm really excited to be here today. I think this is very timely to be discussing managing stress and anxiety during the holiday season and leading up to the holiday season, in addition to a time where we're losing a lot of sunlight, and vitamin D deficiency is a thing. And I think that can many times provoke symptoms of stress and anxiety and depression. So I'm really happy to be here speaking a little more preventively on what we can do when we're starting to notice the signs. So a bit of an overview of what we'll be discussing today. We'll start with defining mindfulness, which is a huge buffer against stress and anxiety. We'll practice a little bit of what it means to be mindful, and we'll tune in with our bodies at the beginning of today's talk. And then we're going to also discuss the symptoms and signs of stress, burnout, and anxiety, and have a list of stress management skills, and then really hone in on how we use our social support to also buffer against stress and anxiety. And then I'll provide a list of resources, both community resources and mental health resources and handouts and things that you can all use for yourselves and your family and friends. So let's start off with what is mindfulness. Before I give my explanation, I encourage you all to participate in this part of it and ask what you think mindfulness means. Joan, you're speaking and I think you're muted. I know, I have such a hard time with this too. Let's see if I ask you to unmute.
Yep, I just tried to do it as well. Let's see if this works.
Unmute. Can you hear me now?
Yes.
Okay. Well, to me, I've been getting into mindfulness quite a bit, and it's a way of really just for me, it's taking time every day to connect just with yourself. You know, we're all so busy. I just started a new job at the library. Jonathan knows that.
Yeah.
And yeah, so you know, it's a lot with what's going on out there in the world today, and just starting something new, and sometimes it just gets a little too crazy. So for me, mindfulness is connecting with myself, and I've really gotten into something pretty daily, every day, if not at night, in the morning. And it's just taking the time to just relax. I find it's really helpful to just take a few minutes, whether it's 5-10 minutes, and just relax myself and, you know, just let it all go, you know, physically first, and then mentally just kind of relax my brain and just focus maybe on my breathing. Breathing is a big part of it, I think. Yeah. So
you brought up some really excellent points, Joan. One being that it's a time to check in with yourself, right? And to see how your body, you use that word specifically, how your body's doing, and to really check in on your breathing. And then a good mindfulness practice, or a helpful, effective mindfulness practice, is one that happens every day. And it doesn't have to be this like large thing. I think many times we overcomplicate what we think mindfulness will be. Sometimes people think they have to like meditate for hours on end, or, you know, do yoga for 30 minutes. And it can really be the simplest thing. Like before this talk, I had a cup of tea and I tried to have a mindful 10 minutes with myself because I've had a really busy day and now I'm coming into this talk. So it's just really thinking through like very simple ways that you can tune in with yourself and your body, and your sensations and your breathing. And I'll go through specifically what it entails. Any other thoughts of what mindfulness means to them or to you?
Well, just for me, again, Joan, I think it's just like kind of just looking at where you're at in your life. You know, when you go through a lot of changes, sometimes you have to keep up with that by your, you know, I mean, life is throwing a lot of changes at you, and I'm open to change. And the more I'm open to change, I find it more necessary to stop and, you know, try and talk to myself, I guess, you know, and just
Mhm.
kind of understand where I'm going and if this is the right decision, you know, and making decisions also by yourself is a big part of mindfulness, I think, too. I don't know,
Yes.
maybe I'm getting a little off track, but yeah, going through changes in your life. I think we're all going through a lot of changes. Being home more, and just trying to maybe, you know, what's more satisfying for yourself, being home more that we were the last year and a half, 2 years, and wanting to get out there again. So
Absolutely.
yeah.
Yeah. Yeah. So I think, yes, mindfulness, there's so much mindfulness that is needed when we're making decisions, right? We think through our thoughts, our feelings, our reactions to the decisions. So I agree. And being mindful to our responses to transitions are especially important because they are a period of vulnerability to stress and anxiety. So I just want to echo everything you said. So here I have two distinctions of mindfulness, two categories, the what and the how. And this comes from dialectical behavior therapy, which is a therapy that very much focuses on how to regulate your emotions. And it's by Marsha Linehan. If you're interested in looking more into it, it's very effective. So what Marsha Linehan says is that what is mindfulness is really observing, describing, and participating in the moment. So that means observing, paying attention to your senses, what sensations are coming through your ears, your eyes, your nose, your skin, your tongue, paying purposeful attention to the present moment, like Joan said, and pushing away nothing, clinging on to nothing, and being the manager of your attention in that moment. Then you want to also describe. So you want to put words to your experience. This allows you to give a name to the things that you fear or the things that you're experiencing in that moment. And actually, there's a lot of studies that show that once you label something, it actually decreases how intense you feel that feeling. So give it a label a thought just as a thought, label emotion, a feeling just as an emotion, an action just as an action. And then participate. That's its literal translation. It means giving yourself wholly to the activity at hand. So if I'm going to be mindful in this moment, I'm going to presently notice everything that's going around with my five senses and try to notice when my thoughts are getting distracted and bring it back. So how do you do it? You take a non-judgmental stance. So this is a big piece, and it's a piece that you have to be careful with too, because you don't want to start judging your judging either, but you want to be mindful that you're not judging yourself in your practice. Like I said before, there's no right or wrong way to do this. It just has to work for you. It has to be effective. And so you want to take a non-judgmental stance. That means don't judge things as good or bad, right or wrong. If you notice your mind drifting it, just notice and then bring it back. You want to be mindful and having the ability to focus the mind and awareness in the current moment, and you want to be effective. You want to, I realized I put participate there twice. That's supposed to say effective. You have to do what works and focus on the desirable outcome, not thinking that you have to do it the right way to get to that. So the desirable outcome here is to reduce stress, anxiety, and whatever way you get to that, we'll talk about it in a bit, is okay. So I'm going to have us practice what we call a body scan. And I encourage you all to try to really participate in this and put your whole thought, feeling, emotion, reactions into this practice. And once you notice your mind drifting, practice the skill of noticing and bringing it back to the practice and my voice. So I'm going to ask that everyone begins by making themselves comfortable, sitting in a chair and allowing your back to be straight, but not stiff, just straight with your feet on the ground. So you could also do this practice standing, or if you prefer, you can lie down and have your head supported, so long that your head is supported. And your hands could be resting gently on your lap or at your side. And I want you to allow your eyes to either close or remain open, your choice. And if they're open, just have them stare at a specific point in your environment, at a low gaze. So we're going to begin by taking several long, slow, deep breaths. Breathing in fully and exhaling slowly. Breathing in through your nose and out through your nose or mouth. And feeling your stomach expand on an inhale and relax and let go as you exhale. So begin to let go of noises around you. Begin to shift your attention from outside to inside yourself. And if you're distracted at any time by the sounds in the room, simply notice this and bring your focus back to your breathing. Now bring your attention down to your feet. Begin observing sensations in your feet. You might want to wiggle your toes a little, feeling your toes against your socks or your shoes or the ground. Just notice without judgment. You might imagine sending your breath down to your feet as if the breath is traveling through the nose to the lungs and through the abdomen all the way down to your feet. And then back up again, out through your nose and lungs. Perhaps you don't feel anything at all. That's okay too. Just allow yourself to feel the sensation of not feeling anything. Take a non-judgmental stance. When you're ready, move your attention up to your ankle and your calves and your knees and your thighs. Observe the sensations you're experiencing throughout your legs. Breathe into and breathe out of the legs. If your mind begins to wander during this exercise, remember to gently bring it back without judgment. Just noticing the sensations of your legs. If you're noticing pain or discomfort or stiffness, don't judge this either. Just simply notice it. Observe how all the sensations rise and fall, shift and change moment to moment. And notice how no sensation is permanent. Just observe and allow the sensations to be in the moment just as they are. Breathe into and out from your legs. On your next breath, I'm going to allow the legs to dissolve into your mind and move to the sensations of your lower back and your pelvis. So I want you to soften and release as you breathe in and out. Slowly move your attention up to your mid-back, your upper back. Become curious about the sensations that are here. You may become aware of sensations in the muscle, temperature, or points of contact with furniture that you're sitting on. With each out breath, you may let go of tension that you're carrying. If your mind begins to drift, bring it back non-judgmentally to this part of your body. Now shift your focus to your stomach and all the internal organs that are here. Perhaps you notice the feeling of your clothing, the process of digestion, or the belly rising and falling with each breath. If you notice opinions arising about these areas, gently let them go and return to noticing sensations. As you continue to breathe, bring your awareness to the chest and heart region, and just notice your heartbeat for 1 second. If you desire, you can put your hand on your heart to become more in tune with your heartbeat. And observe how your chest rises during the inhale and how your chest falls during the exhale. Let go of any judgments that may arise on the next out breath. Shift the focus to your hands and your fingertips. See if you can channel your breathing into and out of this area, as if you're breathing into and out of your hands. If your mind wanders, just gently bring it back. Now shift the focus and bring your awareness up into your arms. Observe the sensation or lack of sensation that may be occurring there. You might notice some difference between the left arm and the right arm. No need to judge this, just notice it. And as you exhale, you may experience the arms soften and release tensions. Now continue to breathe and shift focus to the neck, shoulder, and throat region. This is an area where we often have a lot of tension. Continue to breathe and shift focus to this area. Be with the sensations here. It could be tightness, rigidity, or holding. If you like, you could swallow here or gently open your mouth. You may notice that your shoulders are moving along with your breath. And let go of any thoughts or stories you're telling about this area. As you breathe, you may feel your tension rolling off your shoulders. Now we're at your head. Shift your focus and direct your attention to the scalp, the head, and the face. Observe all the sensations that are happening here. And notice the movement of the air as you breathe into or out of your nostrils or mouth. As you exhale, notice the softening of any tension you may be holding. And now let your attention expand out to include your entire body. Bring into your awareness the top of your head down to the bottom of your toes, and feel the gentle rhythm of the breath as it moves through the body. As we come to the end of this practice, take a full deep breath, taking in all of the energy of the practice, and exhale fully. When you are ready, you can begin to open your eyes and return your attention to the present moment. Any thoughts or reactions on what that was like for people? Judgments that were noticed?
It's Joan. I find I've been practicing this for a while now, and I just find sometimes it's really hard to stay focused into the whole meditation from toes to head. It's very hard. It's hard, and they say the more you do it, the better you get at it. Sometimes I really do feel in tune, and other times I get it. Your mind is so distracted with everything that I find my mind. It's really hard to keep it going, you know.
It is. Thank you for labeling that. So the judgment is, this is hard.
Yeah, this is
right?
hard.
And it is hard. And you're absolutely right that the brain It takes some training for it to become better at this.
Yeah.
And at the same time, this might be something that's effective for some people and not effective for others, and that's okay. Or maybe you focus on different, I did the whole body scan, right? Because I wanted to give you the full picture. And I even tried to speed it up a little bit so it wouldn't be too hard. And you can just focus on, you can just say, I'm going to take a minute to focus on my face and just bring attention to my face for 1 minute and set the timer for 1 minute. Or you could say, I'm just going to bring attention to your neck and shoulders if that's where you carry the most stress.
Sure.
And start off there. So it doesn't have to be the entire meditation either, or the entire body scan. I mean, it can also be parts of it and doing what works.
Right. Yeah, that was like a full body.
Yeah, I took you through your whole body. Yes.
Uh-huh. Yeah.
Okay, so I just want to give you a little bit of a taste of what it looks like to observe, describe, participate, and take a non-judgmental stance, trying to be one mindful and trying to do what worked in the moment. So what did you notice, Joan, worked when you started to get distracted?
What did I notice?
What worked? What helped you get back? Yeah.
What your reminders, constant reminders to just, you constantly said with every part of, what I was focusing on, if what you said is, if you get distracted, bring it back to what you're thinking. So I guess that with you saying that, it helped me, but I guess I have to tell myself that when I'm trying to do it by myself, I guess. Yeah.
Yeah. Both, right? Maybe you might benefit from a guided body scan. There's a bunch on YouTube.
I'm sorry, excuse me. I've just been, I'm on Calm. I do Calm.
Yes, I love the Calm app.
Yeah, Calm is really good. So I use her a lot. Tamara,
love it. She's great.
Yeah, I like her a lot. So she helps me too. Yeah.
Yes, the daily Calm is a great way to practice building that brain power of staying present. And mindfulness is just noticing when your brain gets off track and bringing it back. That is mindfulness. So I wanted to also talk a little bit of what's the difference between stress and anxiety, because I want to make sure that we're aware that stress can lead to anxiety and they're not necessarily always going to show up together. So stress is generally a response that we have to something that's external, and it's usually temporary. For example, like the holidays can be stressful, right? Or taking a big test or having a transition at work. These are things that can be stressful, and if not managed appropriately, can then lead to anxiety. But it's a response to an external cause. It goes away usually, sometimes there's a little bit of remnants right after the stressor is resolved. And let's remember that stress can be something that's really positive, right? If we didn't have stress or some anxiety, we probably wouldn't meet deadlines at work. We probably wouldn't do our chores and our responsibilities at home. So it is something that can be effective. It's just noticing when it is too high or too destructive to our well-being that we need to intervene. So anxiety is more internal, and it's really your reaction to stress. So this involves like persistent feelings of apprehension or dread that just doesn't go away, and it interferes with how you live your daily life. So it interferes with your relationships, with your work, with how you feel about yourself. And it definitely shows up for a longer period of time than stress. So it's constant, even if there is no stressor present. So that's the difference between stress and anxiety. And by the way, this resource is really great. The National Institute of Mental Health, I included it in the PowerPoint, has a bunch of like just really cool coping tools and also resources for kids, adolescents, and adults who struggle with mental health issues. So I wanted to go through a little bit of like how stress shows up in your body and how it shows up in your mood and your behavior, and remembering that if it's left unchecked, it can contribute to many health problems like anxiety, depression, and also high blood pressure, heart disease, obesity, and diabetes. So it's really important that we're checking in with ourselves around this. So on our bodies, It can produce headaches, muscle tension, chest pain, fatigue, change in sex drive, stomach aches, sleep problems. And on your mood, as I said before, it can result in anxiety, restlessness, lack of motivation or focus, feeling overwhelmed, irritability or anger, and sadness or depression. And then how this shows up on your behavior is sometimes over or under eating, irritability and anger outbursts. Sometimes substance misuse happens, tobacco use, social withdrawal, and exercising or moving less often, noticing a lot of lethargy. Remember that this is response to an external cause for a temporary period of time. This is what we see. So now anxiety. This is an internal response to stress that lasts for an extended period of time. So here, symptoms that we want to watch out for are feeling restless, wound up, and on edge without a specific stressor, being easily fatigued and feeling tired often, despite sleeping well, having difficulties concentrating or noticing that your mind is going blank or that you're often ruminating about other things and not being present and mindful. Being irritable is another sign of anxiety. Having muscle tension, difficulty controlling your thoughts and feelings of worry. Sleep problems is one of the most common with anxiety as well. This is difficulties falling or staying asleep, or restlessness or unsatisfying sleep. And an interference, as I said before, of daily functioning across work, school, social functioning. So at these times, I mean, ideally during stressful times, that's when you would seek support. At the time where anxiety signs and symptoms are showing up, this is where it's more urgent need for support. So I want us to take another couple of minutes to look at a self-care assessment tool that I often have students and sometimes patients complete. I put it in the chat, and you can have access to that. I can put it again or if someone can copy and paste it again, that would be great for new people. I don't know if new people joined. And I would want us all to take a look for ourselves, take a couple of minutes, I'll give like 3 minutes to just take a look at the self-care assessment tool and see where we are. In terms of our self-care. So it breaks it up into physical self-care, psychological self-care, emotional, spiritual, and workplace or professional self-care. So it's a little long. I'm not expecting you all to fill this out completely right now, but just get a gauge of where you are for every category.
Kimberly,
Yes.
I'm just seeing it on the wheel. It's kind of hard to see. It's very tiny.
Oh,
Yeah.
I put the link in the chat, Joan.
Oh, yeah. Could you just leave that on there now?
Sure.
Okay.
It's just really long, so I'll have to scroll through.
Yeah, I pretty much get the idea.
Yeah. So I just wanted all of us to take a second to think through where we were in terms of our self-care, because obviously that puts us at a vulnerability for stress and anxiety. I like to do this self-care assessment a couple of times in the year just to see where I'm at, how I'm doing, where I need to improve. And it's really to have a harmony between all of these different areas, because it's not realistic to say that I'm going to be doing well in every single self-care area or category. It's more just to know what's giving and what's taking at the moment and to be mindful to it.
Sure.
And then this wheel, I really appreciate it because it has the same categories. And what it does is it gives you ideas on how to engage in some self-care practices within each category, similar to the self-care assessment. So I just thought it would be a nice addition for you all to have and to think through for yourselves. Is my slide cutting off a little bit, or you see it completely? Okay, maybe it was just me.
I feel like I can see most everything in the column under please. It ends with the word and on the far right side, and take medications
Yes.
as needed. So I think I'm seeing everything on my end.
Okay. I just had something covering it, I think. Thank you. So in addition to those self-care strategies that I'll let you review on your own, I wanted to give you a little bit of other stress management skills that come from DBT, again, dialectical behavior therapy. I am a clinician in DBT, so I pull a lot from that. And there's two sets of skills that I often think are really important when combating stress and anxiety. And the first are emotion regulation skills. So what these are skills that buffer against your vulnerability to develop stress and anxiety. And these are skills that you should be practicing, or you're encouraged to practice on a daily. So when the pandemic first started, most of my sessions just focused on ABC, please. Like, let's just make sure that you're taking care of your body, you're eating well, you're avoiding mood altering drugs, you're getting good sleep, or as good enough sleep as you can get during this time, and that you're getting your body moving and exercising, because that is going to buffer against vulnerability to either depression or anxiety during this time. So that's the please side. And in DBT, we love acronyms. So you'll see a couple of acronyms here. But please is really just bringing mindfulness to the physicality of your body and its health. And this is really important. I mean, I think the eating piece is especially important during this time that we're still in a pandemic, but also during, like I said before, the winter time, because what we eat really determines our mood. Food is your mood. So really being mindful to eating fatty fish, flax seeds, nuts, especially walnuts, dark green leafy vegetables, supplements like omega-3s, turmeric, and vitamin D during this time to buffer against the vulnerability for depression and anxiety due to the vitamin D deficiency or seasonal affective disorder. ABC, that part of the acronym, relates to accumulating positive experiences on the daily, building mastery on the daily, and coping ahead for stressful events as needed. So accumulating positive emotions means that you're just doing things every day that are pleasant to you, whatever that is. And you really have to get clear on yourself and make it realistic that it's something that you can do every day. Building mastery is doing things that we enjoy and that allows us to feel accomplished after. So I personally am not a great cook. And during the pandemic, I said to myself, this is the way I'm going to build mastery. I'm going to try to learn different recipes and get very good at this. And it was such a nice thing for me to see the growth throughout the pandemic and to feel accomplished and in control during a time where I felt so out of control. So building mastery, like cooking, cleaning, fixing a car, working on a crossword puzzle, reading a book, playing or learning an instrument, doing something new, really allows us to feel confident, and that buffers against anxiety, stress. So being mindful of like, what are you building mastery on in this moment? It can also be learning something new at work, or it can be starting a new job. That's a way to build mastery, right? So just being mindful to accumulating positives, building mastery, and then also being mindful to when is there a stressor present in my life and how can I cope ahead for it? So, but when I say cope ahead, I mean rehearsing a plan ahead of time of what you're going to do, what you're going to say, how you're going to respond, and what skills you're going to use before and after the stressor. And that you might need a little bit of more help from like your friends and your support system. And so if I know I have a really stressful day on Friday, I might say to a friend, can you be available for me for a call after my work day on Friday? And that's really me coping ahead in a very small way. I would want to rehearse a little bit of what my day is going to look like and what I'll do throughout the day as well. And making sure I buffer with some skill use before and at the end. Any questions about ABC, please? Okay. So now we have building daily routines with positive experiences. And I just really wanted to like give you a little bit more on this because I think this is so vital to buffering against mood instability. And so when we have thinking of those positive experiences at the top before in the A, accumulating positive experiences, I want us to be mindful of doing this either for our minds, our bodies, or our souls. And when I say soul, I mean that very broadly. Like it can be spirituality, religion, or whatever it is that you do to get in touch with a higher power. If you don't believe in a higher power, then at least like nature and the outdoors, and being connected to that on a daily basis as well. And it can be something so small like looking out your window and watching the tree change its leaves. So I gave you a list of things you can do, mind, body, and soul here. And I also want you to be mindful of like what works for you. And I think what's most important here is the focus on the body too, because movement has shown to decrease vulnerability to stress and anxiety as well. And rhythmic exercises, especially, so running, walking, anything that involves bilateral movements of our bodies and our brains are shown to reduce stress and anxiety. So just being mindful that we're taking care of all parts of our bodies because they're all interconnected and intertwined. So now I have a set of skills that are called distress tolerance skills. So these are the skills we use when we're in a crisis. So I said emotion regulation were the skills that we used when we want to buffer and prevent, right? Distress tolerance is like, okay, you're already in the stressful situation or the anxiety episode, and what do you do? So obviously, if it's an emergency, you definitely want to contact social support 911 or any other emergency systems. And if it feels manageable for you, then thinking through how you can self-soothe with your 5 senses. I took this from Marsha Linehan too. She talks a lot about using vision, hearing, smell, taste, touch, movement to reduce the reactivity of your body in the moment. It reduces arousal. So when you look at something that you consider to be pleasant, and this would be different for all of us. So I want you to, as I'm speaking, to think through what that would be for you. Sometimes I'll pull up pictures of like trips I've gone on and like beaches and nice nature walks I've been on to kind of just tune in to something other than the distress I'm feeling in the moment. Really being mindful of like, there's so many visually pleasing things around us, right? Like if we look out our window on Long Island, I'm not from Long Island, I'm from Queens. So I'm just always like taken away by the greenery in the space. And I sometimes just take a walk and I'm like, wow, look at that tree. So just being mindful to what we have around us and really using it to your advantage. Hearing, so this is a big one too. And it's so soothing and can be so relieving of a stressful situation, making sure you tune in to either some joyful music, or you can maybe hear I have sound machines in my office because sometimes that can be very de-escalating for people that come to see me, or whatever the sounds are that are beneficial to you. It might be the voice of a loved one. I mean, it could literally be anything when it comes to tapping into your senses. Smell or fragrances you enjoy. I personally love essential oils. I think that those are very effective for me. When I feel a little stressed, I sometimes tap into some lotion and just take a mindful moment to distract or self-soothe my senses in that moment. Taste, you can enjoy some of your favorite foods. I don't want to say that eating is a coping skill, and it can be a soothing experience to just have a bite of something that you enjoy. And anything sour and very sweet can actually decrease arousal. So I often recommend, like, if you're having a lot of intense emotion, putting a sour candy, a sour patch, distracts from the intensity of the emotion because of the sourness, or like lime or lemon, or something spicy as well. Touch, this is anything related to, you know, lotions, to showers, to baths, to just feeling the sun on you, to having texture in your workspace or at home that you can hold on to. And the last thing is movement. So this is really stretching your body, walking, running, dancing. I don't know that many of us dance when we're stressed, and it would be a nice opposite action to elicit opposite emotion. But really being mindful of, like, how do I move my body to relieve some of this stress? That can also be very helpful. And then the last crisis survival skill that I'll teach is the TIP skill. So this includes, I told you they love the acronyms. This includes tip your temperature, intense exercise, paced breathing, and progressive muscle relaxation. So tip your temperature it can involve a couple of things. By the book, it really involves putting your face in a cold body of water. So it can be on a sink. And we usually recommend that ice be dunked into it. The reason is that I didn't do this research, but there's a ton of research done on dolphins and the dive effect. So what happens when there's a dive effect is that heart rates, breathing, the body essentially decreases in its arousal to protect itself and last longer underwater. So when we elicit this kind of motion, we lean over in a sink that has cold water, we're kind of producing or eliciting that response from our bodies. I say that that's the way you can do it. You can also just put cold water in your face and kind of hold it. And they usually recommend right under the eyes. And then you can take deep breaths as you do it. I also typically recommend tipping your temperature with very cold water or ice, and wrapping the ice in some sort of protective cloth and then putting it either on your face or your neck, or just holding it. And that can also be relieving of arousal. Intense exercise. I work with a lot of kids, so sometimes I'll say to them, like, do like 50 jumping jacks if you're having really intense emotion and an urge to want to react to that emotion, and get the intensity of that emotion out, or some push-ups, or maybe a really fast-paced walk. It doesn't have to be very long, but just very intense. And the purpose is to relieve the arousal. Paced breathing, we did some of that in our guided exercise today. So it's just really taking a certain count in and a certain count out. The only rule is that the count in should be shorter than the count out. That looks different for everyone. For me, I'm a 4 or 6. So I breathe in 4 and I exhale 6. But some people prefer like 5, 7. You know, it's really up to you. You have to figure that out for yourself. That typically reduces arousal pretty effectively after the 10th breath. And then progressive muscle relaxation. There's many scripts and YouTube videos on this, but this is essentially tightening your muscles and releasing them. So I just did my hands just now, but you can do every part of your body. And that usually relieves anxiety, stress, or intense emotion in the moment. Any question about the crisis survival skills?
I just wanted to say, it's Joan, that the paced breathing has worked for me. But I didn't realize what you just said, that my exhale should be shorter than my inhale should be shorter than my exhale. But it makes sense because you want to breathe longer out.
Exactly. The breath out, Joan, is what actually regulates you. If we're breathing like this, that's actually going to activate your nervous system. So the breath out is what activates the parasympathetic nervous system. Mm-hmm. So just making sure that, and also that you're exhaling through your mouth.
Yeah, and the other thing about the breathing, which I've learned through the mindfulness also, is the correct way to breathe.
Mm-hmm.
Is, you know, when you're inhaling, your belly's out. When you're exhaling, you're breathing, your belly's in.
Yes.
Correct? Yeah.
Yep, that's it.
I never realized, and a lot of people I don't think understand that way of breathing.
Thank
I
you
don't
for bringing that up. Yeah, I think a lot of people think deep breaths look like this.
Right, shoulders.
And that's just a sigh.
I know, it makes it worse.
So the trick really, I have my kids, and I encourage adults to do this too, is to lay on the floor on your bed with a book or an object on your belly,
Mhm.
and really just breathe in. And when you breathe in, notice that object become elevate. And when you breathe
Right.
out, notice that object come down.
Exactly.
So it
Yeah.
really should be a belly breath
Mhm.
versus that, because that produces actually more
Right.
stress in the moment.
Right.
So thank you for highlighting that.
Yeah, and I think, I don't know, I'm speaking for myself, but I think a lot of people don't understand that until they really get into understand, you know, under the whole meditation and all. Yeah.
Mhm. Very true.
Yeah.
Thank you. So this last piece I have for us is just, I think we can't do this alone, right? I can teach you all the skills all day, every day. And it's really important that we have a social support backing to allow us to practice those skills. So I think this is a powerful graph that I'd encourage you all to do for yourself and be really clear for yourself, so that when in moments of stress, you know where to turn to. And really centering yourself in the middle, and working through like who are the family members that you can really turn to, social networks or friends, social environments, so places you can go to, providers and healthcare systems that you can turn to in moments of stress and anxiety, and even local, state, and national policies or resources, which I'll give you today, that you can turn to. I think this is a cope ahead for stress, right? So when I said ABC, please, this is a cope ahead for potential moments when we're in a moment of stress and anxiety or crisis, that we're not going to be able to identify where to turn to because we're in that emotion mind. So I encourage you all to think through this and what this looks like for you. And if you're noticing some gaps in some areas, just be mindful to that there are gaps in your social support circle, and which areas do you have to really use and amplify to fill in those gaps. Oh, I forgot I did this slide. So the last slide is just really like, what does treatment look like? I just want to give you a brief overview if you're ever interested in psychotherapy. So treatment is usually for anxiety and stress management is usually a cognitive behavioral therapy approach, which is essentially looking at how your thoughts, your feelings, your behaviors lead up to anxiety and stress, and teaching a lot of mindfulness and coping skills and thought reframing and thought restructuring. This can be either in individual and group formats, and there's also medication management if we believe that's necessary. And medication is usually provided by either a nurse practitioner or a psychiatrist, can be provided by your primary care physician as well, if they feel comfortable. And usually it's a selective serotonin reuptake inhibitor or monoamine oxidase inhibitor that is used to treat anxiety. Here are the resources I promised. So feel free to, once I give these slides to Jonathan, feel free to go through them, and I'll also provide contact information if you have any questions about them. And then here are some community resources that Stony Brook Medicine uses for patient care, if you go to this website, and then some adult mental health resources in the community. At this time, our wait list is really long and lengthy, and so we want to be mindful that we're being very clear about that while also giving you the support necessary if you're interested in care. And then here are the references that I used to create the slides if you found them helpful and want to do some more digging and reading. And that is it for today. I'll leave these next couple of minutes for any questions.
Joan, Kimberly, that it was really nice to see a lot of this and hear what you've presented. I think it kind of reaffirms some stuff that I had been studying myself, and also filling in some gaps that I wasn't aware of. So I appreciate all of this. And I'd be interested in getting a copy of this from Jonathan in some format, just to have as a resource.
Absolutely. I will send this by tomorrow.
Okay.
And likewise, I will forward that right out to everyone that registered for our program. So
Great.
Thank you.
You're welcome.
anyone else have any questions or comments or thoughts for this evening?
I don't think so.
Great.
Thank you again, Kimberly. Thank you.
Of course. Of
Really,
course.
really appreciate it. It was really informative. Thank you.
Oh, thank you all. I appreciate it.
And Dr. Alba, thank you. Just on behalf of Sayville Library, thank you so much for the time that you took to do our presentation this evening, and truly for giving us a treasure chest of resources that we can turn to when we find ourselves in that particular moment. That's igniting all of our stressors, and, you know, very point well taken. Less daylight when you were talking in the beginning, shorter days, less time to enjoy the outdoors, and maybe use outdoors as a mindfulness technique. There's a little less time, you know, of daylight to do that. And then also the holidays, as joyous as they can be, they can also bring so much stress to us as well. So, so important to have this discussion, especially this time of year. And so the library truly wants to thank you and Stony Brook Medicine for doing this very timely and important program, and something that can be used throughout the year when we're encountering life and just its ebbs and flows. So,
Yes.
thank you so much for
Thank you.
a great presentation this evening. Great. And
Thank you.
it looks like art teacher Amy chatted in our chat box. I definitely recommend looking up guided meditations on YouTube. I have listened to many good ones for years. Absolutely.
Yes, YouTube is one of my greatest resources. I definitely go there a lot. So, and any of these topics that we discussed, you can get more information on YouTube about them. So definitely use that as a resource.
Great. And also at the library here, we are part of the Stony Brook Healthy Libraries program. And so twice a month, we have nursing interns, public health interns, and they are all supervised by an RN. And twice a month, they are here in the library lobby. So they are an excellent resource to turn to should you need. We also have a social worker intern that is on board with us through the year. And so they are here as well. So we just want to remind you that we are right here in the community. If you need anything, you can always turn to us. We are more than happy to help refer, and of course, you know, to send you over to Stony Brook Medicine to visit the professionals like Dr. Alba, who is with us this evening. So keep us in mind. We're all a community, and we're all here to help each other. So thank you. Any other questions for the evening?
I think that's it.
All right.
Okay,
Great.
thank you all so much.
Thank you so
Thank
much, Dr. Alba, for your
Thank you.
presentation.
Night.
Bye-bye.
Bye
Bye-bye.
now.
Thank you for joining us.
Thank you.